Okay, so hello and welcome, guys. Thank you for joining us for today's webinar. My name is Solomon Zuli for Gilitix Media, and we are a digital media company based in Mombasa, dedicated to providing inspirational and transformational stories, which basically to enlighten the society on issues related to their everyday living and giving hope to their community by telling their stories. Today, we are presenting religious leaders' contribution to social cohesion amid the COVID-19 pandemic. This webinar presentation is brought to you by Search for Common Ground Kenya, funded by the European Union in Kenya, which is a project called Pamoja Dhidi ya Corona, a rapid response program that aims at promoting social cohesion and mitigating the spread of false information about the COVID-19 pandemic. Search for Common Ground is a global and profitable organization whose mission is to transform the way the world deals with conflict away from adversarial approaches towards cooperative solutions. Follow this conversation on social media through our hashtag. The hashtag is Pamoja Dhidi ya Corona or the hashtag Baki Salama. Please you can feel free to comment, share, and subscribe on our social media platforms at Gilitips Media, at Search for Common Ground Kenya, on Facebook, Instagram, YouTube, and Twitter. You can just follow the conversation on those social media platforms. Please, you can comment, share, and subscribe. If you have any question during this presentation, please you can type them hapo kwenye you can type them on the comment section in your Facebook during this presentation. Please type them into the comment section either in your Facebook, and then we'll bring up some of those questions during or after this presentation. Now, without further ado, let me just introduce to you our guest today so that we can have this conversation. We were to have Sheikh Hassan Olenado. I'm told that he'll be joining us a little bit later on. Sheikh Hassan Olenado is a national chairman for SUPKEM. And we also have in this conversation today Bishop Zakaria Mwagandi. Bishop Zakaria Mwagandi is the chairman of Mombasa Pastor Fellowship. So Bishop, just to wave to us, Bishop. Yes, Bishop, you can just wave to us so that we know that yes, we are together. Okay, so asante sana Bishop for that. And also we have Daktari Dr. Sanjeev. The other name is a bit difficult. I think he's going to tell us how we pronounce the other name. So Dr.
It's,
Sanjeev
Ag-
will tell us
it's,
how we pronounce
it's,
the other name. Daktari, how do you pronounce this other name?
it's Agarwal.
Agarwal.
Yes, it's correct.
All right, sir. Thank you so much. Dr. Sanjeev is the
Yes,
chairman of Hindu Council of Kenya, Mombasa branch. Asante sana, Dr. Sanjeev. And the Hindu Council of Kenya is an umbrella body of 25 Hindu institutions. Sanjeev is also the founder chairman of Mombasa Eye Hospital and Laser Center. Asante sana, Daktari. I've seen Sheikh has also joined us. Sheikh Hassan Oyenado is there. Okay, so I saw him joining us. Okay. We'll be introducing Chef a little bit later on. So, just to begin the conversation, and know the topic today is about religious leaders' contribution to social cohesion amid the COVID-19 pandemic. So, just to begin this conversation, Bishop, I think I'll start with you, just to explain to us the role of religious leaders. How far do you have? I mean, how far is your involvement in bringing awareness to this disease, especially being that this is something probably new to many of us, Bishop? Yes,
Thank you
Bishop. Just
so much, my brother
yes,
Solomon. Indeed,
yes,
with regards to awareness, when this pandemic broke up, we had different views and perspectives towards the same, and that indeed affected the awareness of the same. But now, almost everybody, actually about 80 or 90% of us have now admitted the existence of the same disease. And I think in any fight of anything, the first step, according to me, is to admit the existence of whatever you are trying to solve or to fight. And so now we have admitted, quite a number of us have admitted the existence of corona, and that has given us mileage in fighting it.
All right. Thank you so much, Bishop, and of course we'll be conversing all through. But just to bring in Dr. Sanjeev and probably tell us probably their role as religious leaders in as far as issues bringing awareness on matters COVID-19. Yes,
Yes,
Dr.
thank you, Solomon. I would like to appreciate that you are on the right platform. We are doing the right thing. In regards to awareness in our communities, yeah, we are just telling people that please don't take this corona just like that. It is a very serious issue, very serious, in fact. Corona is real. Some people are thinking this corona is not real, but many people are dying. Every day we are seeing people are dying. All the hospitals are full. So we should be very careful about it.
Yeah. So, yes. So Dr. Many of the people have downplayed, like these things are not there. So how far in terms of advocacy have you gone, especially probably this time when we are speaking about some of the measures is probably reducing the number of worshippers visiting the places of worship. Dr.
See, we are making people aware that in temple, place like temple and all, they should not gather many people together. We should follow the government guidelines, MOH, Ministry of Health guidelines. Like you should not be more than 15 people in the temple together, and maintain the distance same time. Wear their mask. All those things are very important. Sanitize your hand before you enter. Also, they should take your temperature before you enter in any premises. So these measures are very important. These are primary measures one should take it before they enter any premises. So we are making all these people aware that please take it very seriously.
Okay. Okay, Asante Daktari. So we'll be getting to you a little bit later on. So let me just bring in Sheikh Hassan Olenado, the national chairman of SUPKEM. So Sheikh, probably you'll also tell us on your side how far have you gone in terms of advocacy and probably your role as a religious leader in far as bringing awareness on matters COVID-19, Sheikh Hassan.
Uh, should I?
Hello. Good evening, Zuli and team.
Good evening, Sheikh Hassan. Karibu sana, we can hear you.
Yeah, my apologies because I'm actually in my rural village and the network is not stable. And
Okay.
that is why I was struggling to get myself online. But I think this discussion is coming in at the right time, at a time when the country is once again facing serious challenges on COVID-19 and also issues to do with the criminality and challenges to do with young peoples and also other Kenyans in terms of we have seen a lot of violence, even in the home-based, home-based violence, increasing in the country. And all these have to do in one way or the other with the challenges of COVID-19. Because COVID-19 have somehow put our life in a very difficult situation. The way we interact, the way we engage, the way we move from one place to another, the way we socialize, and everything else have been actually undermined by this pandemic. And that's one of the reasons why we feel the religious community, the religious leadership have a responsibility in terms of counseling its membership and to ensure that the people of faith of all traditions are actually going back to their places of worship and also praying to God to change the situation. And we cannot do that and we cannot escape from it if we are not actually doing a lot of things in terms of ensuring that our communities appreciate the challenges and of course turn to God, and we must be playing the role of counseling so that we are able to counsel the members of our societies that are facing more challenges or those who are more vulnerable. Maybe I stop there for now, and if there is anything else, I'm happy to say.
No, okay, sir. Thank you so much. We'll be getting to you a little bit later on. Let me just bring in Bishop and probably to tell us some of these initiatives. Sheikh Hassan Olinado was talking about, starting things like uh, offering counseling and all this. But probably just to dive into this issue, Bishop, what initiatives have your respective institutions probably undertaken to help first in combating the disease and the factors of social cohesion around this pandemic, Bishop?
Thank you so much, my brother Solomon, and everybody viewing and listening to us. Um, One of the most important things that I have done or we have done is to put in provided for protocols by the government. And by so doing, I have seen or we have seen that members are really taking heed to that because it has come to the understanding that this is no joke. It's a real thing. And so sanitization, fumigation, cleanliness, social distancing, proper wearing of face masks and the like have been the norm of the day. And so as a religious institution, I have or we have put more emphasis on this. And also avoiding big numbers in our services, so to say, and also some gatherings like ceremonies, wedding ceremonies, and funerals. This has really been a challenge, but at least we have tried and we have seen some improvement in most of these members.
Okay, okay. Dr. probably just here on your side of the story, on especially some of the initiatives that you as religious leaders have taken to help combat this disease and also matters to do with social cohesion around this pandemic, Dr. Okay. Let's see, we have an issue with okay, there he is. Okay.
Yeah, we
So,
started
yes,
like
yes, go
yes,
ahead, Dr.
we have started this exercise of vaccination to the people who are over 58 years old. We are taking them to the different hospitals in the batch of 10 to 20s, like go to Jocham Hospital, going to Pandya, taking to Aga Khan. So at least, this protection by vaccine is very, very important. It's like, when it's raining and you're putting umbrella on top of you, it really protects you. So people think that vaccine is no use, but it's not true. The vaccine is really, really important. It's like a shield to your health. It's very important. So we as a Hindu leaders, we are encouraging our people to go maximum to any hospital if they can, or they can give us their numbers. We can take them to the hospital for the vaccination. And we are doing this very vigorously to all our members. And I also like to appeal all the people, irrespective of religion or the caste or tribe, they should go for the vaccination. It's very, very important, actually. I encourage that.
Oh, okay. So let me just bring in Sheikh Hassan. Sheikh Hassan, you know that we are getting into the holy month of Ramadan and all these measures that have been put in place. Again, a delicate balance between the norm that we were used to and now things are a bit different. So how do we go about this?
Thank you, Zuli. I think we have actually given an advice to the Muslim community that we are in times of difficulties, and our lives cannot remain the way they have been because of COVID-19. We have actually appealed to the community to adhere by the guidance of the Minister of Health, and more importantly, also the protocols that were developed by Interfaith Council on the response of COVID-19, which of many of us religious leaders are actually members. We also know for now that we have 5 counties under lockdown. And those counties, places of worship are closed. We are encouraging the members of our society that to keep praying God in their places of where they live, without necessarily feeling bad that is something that the government or any other person is doing it, but we all of us cry to God to change the situation. For those who are in the remaining 39 counties, we are appealing to them to adhere to the protocols of 1.5 meters social distancing. We are asking them to wear face mask fully, to wash their hands or sanitize, and not to spend a lot of time in the congregations wherever they are, even outside the places of worship. They should just do their worship and immediately leave to other places, so that at least we minimize the interactions. I know the question that the Muslims have been asking, especially in the month of Ramadan, is the night prayer, Taraweeh prayers. For in the areas like, again, the 39 counties that are not affected by the lockdown, those are free to be able to perform Taraweeh, but within the time frame of curfew. So they have to maintain the regulations, the guidance that have been given, but pray within the curfew time, because beyond 10 o'clock, it's going to be a terrible problem. So we ask them at least to finalize their worship, their prayers by 9, so that they are able to go back to their homes in time, so that they cannot be seen to be violating the guidance or the protocols of the curfew. Those are the advices which we have given, and we hope the community will adhere, because we are actually suffering from the problem. Thank you.
Thank you so much for that, Sheikh Hassan Olenado, the national chairman of SUKEM. Let me just bring in Bishop Zakaria. And Bishop, there's been a lot of divisions on matters, probably those who have survived COVID-19, a lot of stigmatization and all these. Some of these people are among your congregation, Bishop. What message do you have as a religious leader, especially on this issue of stigmatization and division of for those who have survived COVID-19, Bishop?
Once again, thank you so much, Solomon. And now, with regards to divisiveness on the side of the survivors, I have personally had one-on-one time with them, talk to them, give them good counsel. The other thing I have done is to show them love, but so carefully, observing all the protocols on my side, even as I share with them and show them love. That has been my emphasis. And on the side of the congregants, yes, I know we have some of them. It has not been very easy to expose them. I've been putting general sentiments on how to take care of such in case one comes across a survivor, how they're supposed to regard them, interact with them, and socialize with them and stuff. So the basis has been carefully showing them love and creating time to give them good counsel on how to live with others fearlessly, so that they lead a normal life.
Mm-hmm. Okay.
Yeah.
Okay, let me just bring in Daktari. Apart from being a religious leader, Daktari, you are also a doctor. How do we deal with this issue of stigmatization, Daktari? And probably these are things you've experienced in your place of work and probably also in your place of worship. How do we deal with this, Daktari?
See, Mr. Solomon, I would say this is a very difficult time for all of us. It's not only one particular tribe or the religion. People are losing their jobs. So many issues are coming up actually because of COVID. But we just have to make people aware that please let's just fight together, because this is not a one-person race. It is together we can achieve. Together we can fight this race easily. So we're just telling people, please don't get panic. Don't get panic. Yeah, there's a solution. So once you get a COVID, please seek a medical advice, go to the hospitals, and you'll be cured. So we're just passing this message that don't get panic, please. This is curable. This is curable. And this is
Okay.
a temporary phase. This is not permanent. It is going to go definitely.
Mhm. Okay. Thank you so much for that, Daktari. Sheikh Hassan, earlier on, you were speaking about violence, and probably we've all heard about the increment in cases of gender-based violence, especially during this time of pandemic. So, have you experienced this probably, and what has been your role in trying to mitigate this situation of violence or gender-based violence during this pandemic,
Uh,
Sheikh Hassan?
Zuli, we have an association of Muslim counselors that came into being some few months ago. And we are very
Mhm.
grateful for the work that group has done across the country. They started by training the Muslim, what do you call, the madrasa teachers on how to handle issues at the madrasa level. They have also engaged communities, uh, just as training them as TOTs to be able to address the problem. Note that actually the challenges we are currently facing are not necessarily COVID per se, but the major cause is COVID, because the situation, the challenges in the economic situation in the country, the challenges we are facing, a lack of jobs, people have lost their jobs, they have lost their incomes and livelihoods, is actually torturing people. And people can do whatever they can do for the purposes of just to get rid of the challenges they are facing. And this is some of the things that we are asking, especially our religious, the faith leaders, and those responsible for messaging to be able to work a little bit more in terms of counseling the members of the society. We also know that some of our faithful are largely have confidence with the faith leaders. So there is a likelihood that faith leaders can be able to know which member of the group is facing certain challenges. And we are glad because some situations have been saved and others have not, because not everyone else can come out to say, look, I am suffering from this problem. But I'm sure all the faiths have been able to handle those situations in an event that someone comes forward. So we need to train our religious leaders to know, at least to observe their members when they are not okay. So for the purposes of being able to reach out and to console them whenever they need. Otherwise, I think so far so good, but the challenge is enormous.
Okay. So far, so good, but the challenge is enormous. But Bishop, is this the same issue on your side, on matters to do with gender-based violence, and probably what are you doing as a church in trying to mitigate this situation? Now that Sheikh has admitted that indeed this is something that is with us, and the challenges are huge. Bishop.
Yes, thank you, Zuli. Personally, I have not witnessed a case or a standing out one within my locality, but I have heard of such happening in other places. However, as a religious leader, we had a seminar the other day for all the married couples, and it was a good forum to give out or provide for some counseling on such, though nobody came out telling us exactly what they went through during this pandemic, but we gave some general counseling with regards to the same. Otherwise, yes, it is a huge challenge amongst us, but we have really done our best and we are still doing our best to avoid the same. Yesterday, for example, I had a meeting with all the youths that were present, and we shared about similar things with regards to this pandemic. That's the effort so far. Grouping or in group gatherings to discuss on similar so that we avoid gender-based violence.
Okay. Thank you.
Yeah.
Thank you so much for that, Bishop. And good thing that you sat down with the youths and had a conversation. And probably these are things that we should be having more frequently. Daktari, is this the case on your side? How is it? Bit unique on your side, or how is it, Daktari?
Uh, See, on our side, the hospital, we are taking care of our staff nicely, and awareness, to the community people, so they're following all the directions. So far, we haven't heard any bad news. Only people who are really have secondary issues, like with the health. Maybe few of them they're dying. Otherwise, the situation is under control. Especially Mombasa is not that bad, actually. I would say. We are thankful to
Mhm.
God for that. God is very kind to us, and we are fine.
Yeah.
Finally, I would just like to say that people should wear their mask. They should keep distancing, and if they don't need to go out, please don't go unnecessary. Yeah, just take care of yourself and your family. That's my message to people.
Okay, Dr. Sheikh and Bishop speaking about offering counseling, especially on matters to do with gender-based violence. How is the situation probably on
Truly,
this
we haven't
specific issue
heard
of gender-based violence?
Mrs. Willie, we haven't heard something like that, that people are doing violence at home or something. So far, we haven't heard anything. But if we hear something like that, then we have people who can go to their houses and do the counseling for them. We have people, trained people. So time to time, we have been sending messages. People, if you have any problem, please discuss with us. We have our community numbers, given to all the organizations, all the institutions. So whenever they have issues,
Mhm.
we always come to know. So far, we haven't heard any bad news so far. Yes.
Okay. Okay. So, Sheikh, Bishop, and Daktari, loss of jobs, and I think this is a conversation that has popped up today. That with COVID-19, a lot of people have lost their jobs and that sense of livelihood. Probably this has affected so many people in society, and probably during this such times you will seek assistance from places of worship as leaders in your respective calling. What initiative have you come up with to make sure that people do not fall into depression and other mental health issues? And yes, it's a challenge for everyone. You will probably think that if you go to the church, if you go to the mosque, if you go to the to the temple, this is where you will at least get some assistance. Sure. At the same time, it's also a challenge to you. How do we handle this, Sheikh Hassan? Okay, I think we have a challenge with Sheikh Hassan's connection. Probably, Bishop, you can help us on this. That people have lost jobs. You don't have anywhere to go. People are sleeping hungry. They will come to the church for assistance. Bishop, what are you doing to make sure that people do not fall into depression and other mental health issues, Bishop? And
Thank you so much,
probably
Bonnie.
what?
Right. Okay. I have come across a few cases of people who have lost jobs and have difficulties in livelihood. My counsel my counsel has been that first of all to give them some hope that if one door closes, another one may open up, and also that they should be able to be flexible so that when this one job goes, you should be able to say, let me adjust and perhaps try some other ways and means of livelihood rather than having a rigid or stingy mind. Another thing is that as a church, we have been able also to provide physical assistance, like some food stuff, sometimes clothing, of course, temporarily, as we hope for them to acquire or to get some other ways of living. It is a real challenge. Sometimes I've had to call for a group meeting of such people who have lost jobs so that we can encourage, pray together with them as we advise them on other means and ways of earning. Yeah.
Mhm. Mm. Okay. 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 Thank you so much for that, Bishop.
Yeah.
Dr. Bishop is telling us, encouraging people that when one door closes, another one is going to open, and we have to keep on pushing. This does not mean that it is the end of life. So, how are you probably dealing with this, Daktari, on your side? Probably as a religious leader and as a professional doctor, Daktari, on matters to do with loss of jobs, guys are hungry, people are falling into depression and other mental health issues. Daktari.
Yes, in that case, what we are doing actually, we are marking the families who are, on the bit on the poor side. Yeah, so we have the list of those families. In case they need food, we providing them the food. In case they
Mhm.
need assistance with the rent, we try to help them how we can.
Mhm.
So it's a small thing we are trying to help them. Yes.
Okay, and these are probably initiatives that have been going on, Daktari, for paying rent and probably the food
The
aspect.
food distribution, yes. This program is on
Mm.
actually from our council. Yes.
Okay, okay, okay. A lot of debate that has been going on, Daktari, about the COVID-19 vaccine, and probably everyone has his own issue about the vaccine. As a doctor, probably, Daktari, what will you tell the people out there who are listening today about this COVID-19 vaccine? Okay. I see we have a bit of an issue. Remember, you can follow this conversation on our Facebook page at Gilitix Media, or at search for Common Ground. The hashtag is pamoja dhidi ya corona. That is the hashtag you can use, or hashtag baki salama. And of course, we had asked Daktari about the issue of the COVID-19 vaccine. I see we have a bit of an issue with Daktari's connection, so probably let me just bring in Bishop. Bishop, the conversation about the vaccine. Tunawaambia nini waumini kuhusiana na vaccine, Bishop?
This is another bone of contention with regards to the religious groups, especially the church, because to some of us, they believe that it's the beginning of the 666, and some of them have got different theories actually on the same. But the
Yeah.
truth of the matter is, as one of us was sharing, that it's like an umbrella whereby you hide yourself from the scorching sun. You get vaccinated, you get prevention. And indeed, this is an answer to a prayer which we had some time last year when there was when the pandemic started. We were asking God to provide for a way out, either a vaccine, if not some treatment. And to us, we thank God that the vaccine is out, regardless of the different theories happening. But I know it is helping some of us. And maybe it's because of it. Now that it is out of stock, maybe that can relate. But I know some of us, and if not most of us, are ready to receive the vaccine as a preventive measure. So, being an issue, yes, but slowly we are beginning to accept that this is helpful to some of us, if not all of us.
Okay. Okay. Thank you so much for that,
Yeah.
Bishop. Daktari, Bishop says a bit of a bone of contention there with the vaccine, Daktari. So, what are we advising Kenyans? What are we telling the congregants, Daktari, Dr. Sanjeev? If you can hear me, Daktari. Okay. I see we have a bit of an issue there. So, probably we'll just move into. Is Sheikh Hassan still with us? Okay. Okay. Just check. All right. So, Gilbert, probably we should just sample some of the comments that are coming in, or if there are questions, so that we can throw them to our guests before we go into the other questions. Gilbert, if you can have the questions kindly, so that we can. Huh. Honorable Bethwell Washington says, very true, Monsignor Dr. Sanjeev, vaccine is very important. People should stop politicizing this practice. Let everyone get vaccinated. Hashtag let's fight this corona. Asante sana Mheshimiwa Bethwell Washington. Tuko pamoja, shukran sana. Mheshimiwa hapo anasema this
Sorry,
vaccine. Yes, yes, yes. So Gilbert, if we can have the comment once again before we ask Daktari about the vaccine.
yes, Julie, I would like to say the final words. The vaccine is completely safe. People should not have the second thought about it.
Yes.
Yes.
It's
And
completely safe.
completely safe. I've been reading all the articles and I've been reading through media. I've been reading through the company which is making this vaccine also. I've been doing a lot of research. So I would like to urge Kenyans, please, 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 don't have a second thought. Go for it. It's very important because the cases are increasing in our country. We must take care of ourselves and our loved ones. Thank you so much.
Okay, thank you so much for that, Daktari. Asante sana. So, Bishop, you will agree with me that peace is an important aspect to be considered during this pandemic. In your opinion, as a member of the church, what do you think is the best approach in dealing with the COVID-19 in a way that citizens and security actors will not be in conflict, Bishop? Especially now that we have
I
curfews
think it
imposed,
is.
and we are told that we need to also probably limit the number of people that are getting into our churches and temples. Yes, that's right, about Bishop.
It is always good to understand that this pandemic is not meant to divide us. Actually, it is a challenge to all of us here. But we need to be having forums whereby each one of us will be ready to accept each other in their levels or at their levels. In another view also, if we can have the security men have general forums with almost everybody, if not the leaders, so that it can be a common ground of sharing during sharing different experiences, and also let people express themselves. With regard to the observation of the protocols, askari kama amepata mtu hana mask na anaweza kumnunulia ama kumpatia, instead of harassing them, why don't you just provide like 10, 20, buy one and give this person instead of taking them to a police cell or a court or something? That's my view. Again, at times you may be caught up during curfew hours na labda ni mtu tu amechelewa kidogo dukani, just a few minutes to 10, napatikana tayari ni mhalifu. Why not get the citizens peacefully without having to threaten them and demanding some bribes from them? So let there be some smooth handling of citizens just in case is caught up beyond curfew hours. And if one is without a mask, it can happen. Mtu anaweza tembea nayo, labda kwa bahati mbaya amefua ikaanguka, unakutana na police and you are in for it. So I think there has to be a smooth way of dealing with mwananchi when it
Mhm.
comes to provided for protocols. Thank you.
Thank you. Thank you so much. Daktari, how do you deal with this, especially now that we have security apparatus not getting into conflict with common mwananchi, especially with some of the measures that have been put in place so that we can make sure we have peace, especially during these times of pandemic. Probably, have you followed some of the protocols that have been put in place on the places of worship and probably places of work?
See what we do normally at the place of work and worship places, we keep extra mask in case people doesn't come with the mask. We give them one, so
Mhm.
that way they are fine. Another thing my friend says, very valid point, that the police harassing these people, which is really bad. It's not the right way. They should they should be people should be treated with the dignity and the respect, no matter what. you know that is my opinion, personal opinion. They should not be harassing people for a mask. Actually, in fact, police should be carrying some mask. Okay, please take one. In my opinion, it's not a matter of harassing. It's a matter of helping each other this time.
Okay. Thank you so much for that, Dr. It is not a matter of harassing, it's about helping each other during this difficult time. As we wind up, probably access to equality has been a topic of discussion when it comes to COVID-19 treatment, and now that the vaccine has come up, probably as a member of the religious leaders, what is it that needs to be done for us to achieve equality in this pandemic? Bishop, how do we deal with this, and making sure that we have equality all through during this time of the pandemic? And of course, we've had some conversations that have been going on that corona sijui ni ya hawa, sijui corona ni ya wale, corona ni ya sijui kina nani, corona inakula kina nani. Bishop.
Yeah.
Bishop, if you can hear me. Yes, Bishop, can you hear me? Bishop,
Uh,
please,
yes.
go ahead.
Yeah, but there's a lot of discussion.
Okay,
There's a
the
lot
question
of
was
discussion.
distortion. Can you hear me now?
Uh,
Yeah,
yes,
the question was
again.
about yes, the question was about access to equality when it comes to COVID-19
Mhm.
on the treatment side. And now that there's a vaccine too, as a member of the church, what is it that needs to be done for us to achieve equality in this pandemic?
I guess this pandemic cut across. It is not a respecter of anyone. Anyone is prone to acquisition of the same. And so, if other groups are considered to be eligible to be vaccinated, I think all of us need to be at least apportion some percentage of reception of the same vaccine. Like now, Zumeisha is out of stock. Here is a group of religious leaders who interact with a lot of people on a daily basis, on a weekly basis. And let me say that we have not been considered or apportioned the same. So a lot needs to be done with regards to accessibility and equality in this life.
Mhm. Okay, okay. A lot needs to be done. Daktari, on the issue of equality, and of course, this conversation we've had it now that we have a vaccine, that this vaccine is for the common mwananchi, this one is for a specific class of people, the treatment on COVID-19, the issue of having classes and all that. How do we achieve equality, Daktari, during this difficult time?
I think I would say the government of Kenya has done something very wonderful. Uh, they're only using one vaccine for everyone. There was the one with someone wanted to bring to the country. The government has stopped it. So I think the government doing the best they can do. So people can go for one vaccine only. So it will bring the equality among the people, definitely. So there's nothing like people have another option of going for a Sputnik or another. There's no.
Mhm.
AstraZeneca is the only vaccine they've been given to all the people in the whole country, respective of any religion, caste, or tribe. So there's no matter of inequality at the moment. I would say the government doing a wonderful job.
But Dr. Probably on the treatment of COVID-19, and of course, it's been whatever the figures that we have been seeing, very expensive figures, Dr. A lot of the common man cannot afford that, Dr.
Yes, I understand, but we are so grateful that Mombasa the cases are very low. In other part of the country like Nairobi and Eldoret, Kisumu, they're increasing more higher. I wonder why. But we still say thank God that Mombasa is not that bad.
Okay. Okay, thank you so much, Dr. Sanjeev and Bishop Zakaria. Gilbert, probably as we wrap up, do we have any questions? Do we have any comments that we can have a look at them before we call it a day? Because how do you advise us? EM Nanyuli is asking, how do you advise us not to have second thoughts yet we are hearing cases of blood clotting and side effects? What should be what we should be advocating for is an alternative approach of the vaccination. Yes, Daktari, the issue of blood clots. How do you advise us not to have second thoughts while we have had such issues of blood clots? Daktari, on the vaccination?
See, people who don't want to go for the vaccine, what they can do, they can isolate themselves. They take care at home. They don't go out. Otherwise, the matter of clotting is very little actually. I would say 0.001. So out of 1
Mm,
million people, if one person gets the clot, it's very minimal, because maybe that person has another complication in the body, and
mhm,
everybody's body react differently with the medicine. It's not only with that medicine. You eat even Panadol, it can react with the
mhm.
body sometimes. So any medicine has the complication. We shouldn't take it that, oh, you're having because of this vaccine. No, I don't think so. Yes,
Okay. So if you don't
yes,
want to have the vaccine, just stay safe, mask up, social distance, sanitize.
perfect.
Yes. Thank you so much, Dr. Gilbert. If you have some more questions, um, before we probably wind up, this has been brought to you by Search for Common Ground. The hashtag is pamoja dhidi ya corona, hashtag baki salama. The conversation is continuing on Twitter, Facebook, Instagram. You can follow us at Beauty Media at Search for Common Ground. Yes. So probably as we wrap up, Daktari and Bishop, uh, maneno ya mwisho kabisa, nini tutaweza kuambia Wakenya wakati ambapo tunamalizia mazungumzo yetu jioni ya leo?
Thank you so much for this opportunity to be part of this wonderful discussion. And mine is to say, let's keep on observing the provided for protocols against COVID-19, and also pray to God for His assistance, because this is a real battle. But I know through prayer and observation of the given protocols, we are more than conquerors. Thank you so much, Benedict.
Asante sana Bishop Zakaria Mogandi, Chairman Mombasa Pastors Fellowship. Daktari, you get the last say as we finish up.
Really, thank you very much. You organized such a wonderful organized day. It's really, I feel privileged. And I would like to tell people, please take care of yourself, whether this is a corona or not corona. Please take good care of yourself.
Okay.
Thank you.
Asante sana daktari. You also take good care of yourself. Asante
Thank you so much.
Bishop Zakaria Magindi, Chairman Mombasa Pastors Fellowship. Asante sana Sheikh Hassan Olinado, the Chairman, National Chairman.
Thank you.
Tupken, thank you so much, Dr. Sanjeev, the Chairman of Hindu Council of Kenya, Mombasa branch, and also the Chairman and founder of Mombasa Eye Hospital and Leisure Center. Thank you so much to everyone that has been watching behind the scene. Asanteni sana, it's been a success. The conversation continues on Facebook. The hashtag is pamoja dhidi ya corona, hashtag baki salama. This has been brought to you by Search for Common Ground in conjunction with the European Union and Gilbert Media. Asanteni sana. You have a lovely evening and stay safe. Thank
Thank
you
you
so
so
much.
much.
Thank
Asante.
you. Bye bye.
Thank you. Bye.
Bye.